This video presentation will focus on chronic kidney disease and will be presented by Brianna Nelson, Hbu.Ckd, Annie Nguyen, and Isha Patel. What is chronic kidney disease? Chronic kidney disease is the progressive loss of renal function over a period of months or years. Its disease includes conditions that damage your kidneys and decrease their ability to function.
People with early chronic kidney disease tend not to feel ill or notice any symptoms. However, as renal function deteriorates, the clinical manifestations become evident. Fatigue, lethargy, and pruritus are often the early symptoms. Hypertension and proteinuria are often the first signs. Hyperglycemia, hyperinsulinemia, and hyperlipidemia, and an abnormal glucose test may be seen. Other symptoms include nausea, vomiting, loss of appetite, fatigue, weakness, sleep problems, change in urine output, decreased mental sharpness, muscle twitches and cramps, swelling of the feet and ankles, persistent itching, and high blood pressure. Over 26 million adults have chronic kidney disease, and 1 million more are at increased risk, as you can see in the data collected from the National Health and Nutrition Examination Survey. With increased age, the prevalence of CKD increases. Males are at greater risk than females. African Americans have the highest rate of CKD, nearly 4 times that of whites, and diabetics have the highest risk for CKD. Risk factors for developing chronic kidney disease include diabetes and hypertension, which are the leading cause of CKD. Other risk factors include cardiovascular disease, obesity, high cholesterol, smoking, lupus, having a family history of CKD, age 65 or older, or being African American, Native American, or Asian American.
Prevention of chronic kidney disease. How can we prevent it? Chronic kidney disease may be prevented by controlling the other disease factors that may contribute to the actual kidney disease. The number one thing you can do is to keep your blood pressure below 130/80. Also, if a patient has diabetes, they should keep their blood sugar within a target range. They should also maintain a healthy weight. This can help prevent other diseases such as diabetes, high blood pressure, and heart disease. They should control their cholesterol levels because this will also help decrease high blood pressure and heart disease. And lastly, they should not smoke or use any other tobacco products. Smoking can lead to atherosclerosis, which reduces blood flow to the kidneys and can increase the blood pressure. Detection. How do we detect chronic kidney disease? Chronic kidney disease is typically detected by measuring serum creatinine levels to calculate the glomerular filtration rate and by measuring the urinary albumin-creatinine ratio to detect proteinuria. Although the most common cause of chronic kidney disease is diabetes and hypertension, the disease can be caused by many other conditions. Because chronic kidney disease is progressive, early detection is important for overall health and well-being.
Okay, right now I'm going to discuss evidence-based treatments for chronic kidney disease. When you're initially diagnosed with chronic kidney disease, you want to control your blood pressure. And how you can do that is with ACE inhibitors, which are angiotensin-converting enzyme inhibitors, and angiotensin receptor blockers. You would also be prescribed phosphate binders, which control your phosphate levels because with chronic kidney disease, your phosphate levels can be elevated. You want to protect your kidneys by regular exercise, controlling your blood pressure, not smoking, stay on a low cholesterol, low fat diet, okay? And other dietary restrictions could possibly be limiting your fluid intake. You could also have anemia supplements, which would be iron supplements or eating more iron in your diet. You also want to maintain an adequate calorie intake because you'll be losing weight. And once a patient reaches stage 5 chronic kidney disease, renal replacement therapy is required, which would include hemodialysis or kidney transplant. And chronic kidney disease affects multiple dimensions of health, obviously. One, because it's chronic, it affects you for the rest of your life, every day of your life. It's emotionally draining because there isn't exactly a cure. There's also monetary burdens because you have to pay for meds, you have to pay for treatment, you have to there's also setting aside time to go get treatment, which can be an inconvenience because dialysis is multiple times a day. And then last but not least, you're fatigued and your activity levels are decreased because your body isn't able to filter out the toxins and it's not functioning as properly as it should be. So the effects of chronic kidney disease on multiple dimensions of health are: 1, it's chronic, so it affects every day of your life for the rest of your life. 2, it's emotionally draining because there isn't exactly a cure. 3, there are monetary burdens because you have to pay for meds, you have to pay for therapy, you have to pay for gas to get to therapy, and you have to pay for all the lifestyle changes that you're making for this disease. And 4, it's an inconvenience because you have to set aside time for therapy such as dialysis, and it's multiple times a day. So you have to change everything about your life. And last but not least, you're fatigued and your activity levels are decreased because your body isn't filtering everything that it should be and isn't working as properly as it should be.
So many patients go to their physicians to get relief for chronic kidney disease for their physical symptoms, but many of them don't realize is that chronic kidney disease has a lot of psychological effects on the body and the mind. Some of the emotions that chronic kidney disease patients battle with are fear, anxiety, anger, and depression. Fear because your body isn't working the way it should, your kidneys aren't functioning, you no longer have a control in how your body functions. And anxiety because either because of medication or dialysis treatment, it can be very stressful since you have to go roughly 3 times a day. And you had to have surgery to gain access for dialysis treatment. Anxiety in a chronic kidney disease patient can also occur because maybe they're waiting for a transplant, and transplants don't always come through. You hardly ever hear of one coming through. It takes a while to actually get a transplant. So some of the ways that physicians say that you should combat that anxiety is by occupying yourself, staying positive, and talking to your healthcare provider and asking them any questions that you have. So anger is another big emotion that chronic kidney disease patients feel, mainly because they're upset themselves for allowing their health to get so bad, or they're upset at their healthcare providers for not taking good enough care of them. And so this anger just builds up on the inside until you let it out on your family members or your healthcare team, and it just creates a lot of hostility and resentment and a strain on the relationship that you have there. So depression is another emotion that chronic kidney disease patients struggle with, mainly because they're upset at themselves or they're just sad about the fact that their body doesn't work the way it should. Some of the symptoms of depression include low appetite, sleeping a lot, and a low urine output. The problem with depression is that it can lead into hopelessness, which can lead into clinical depression. So if you have these symptoms for more than 2 weeks, notify your healthcare provider immediately. And if you have any symptoms of harming yourself or harming others, notify anyone immediately. So how do you combat all of these emotions? Some say that you should ask your healthcare provider about your disease process, play an active role in your disease. Don't just stand on the sidelines and let everyone do everything for you. And stay positive, which I know that sounds really weird and dumb for chronic kidney disease. How do you stay positive for this kind of disease? Well, it's all in how you think about your disease. I went on Hbu.Ckd and I looked at some testimonials about patients who have this disease, and some of them said it's how you look at the disease and how it affects your life that really, really changes your prognosis. So one patient said that they viewed their dialysis treatment like brushing their teeth. They equate it to brushing their teeth. It's just something that you have to do, and that's that. It's not anything debilitating. It's just something that you have to do. Another patient said that they don't live for dialysis, but but dialysis allows them to live. It's not a negative thing, but it's a positive thing. Okay, so another way that you can combat these emotions is by talking to your social worker. Really and truly, the social worker is the only person in your healthcare team that is qualified to help you meet the challenges that chronic kidney disease presents. So they can help you and your family come up with coping strategies and problem-solving techniques for your disease. And patients usually refer to their social worker at the dialysis center because all dialysis centers have to have social workers. Another way that you can combat with this disease electronically is through a discussion forum or an email list. There are lots of discussion forums on Hbu.Ckd where you can talk to others about your disease process and express your feelings that way. And then there's also email lists. Email lists are really useful because you can talk to hundreds of people that have your disease process. Some of the email lists, some of the most common email lists are Dialysis Support, and it's a group that specializes in end-stage renal disease, Friends and Kidney Support, and Kidney Corner. Another useful tool that you can use to combat these feelings are support groups. If you or your family member is one of those people that prefers face-to-face contact, support groups would be beneficial. Support groups consist of family members with chronic kidney disease or patients struggling with the disease, and they're usually led by a leader who's experienced and knowledgeable in chronic kidney disease. These discussion groups usually have activities or they're just places where you can discuss what you're going through and get feedback. Some groups in Houston, some support groups in Houston are transplant partners at Memorial Hermann Hospital and dialysis peer support group. So the rehabilitation goal for patients with chronic kidney disease is to improve the quality of their life. So everything that I've just said, staying positive is a good way to improve your quality of life, maintaining a healthy state of being, so exercising and eating well, enjoying your friends and family, and taking an active role in your disease process helps improve your quality of life. All of these things in conjunction with medication regimens and dialysis treatments will help improve the quality of life. So from all of us in the Chronic Kidney Disease Teaching Project, Isha Patel, Crystal Moncada, Annie Wynn, and Brianna Nelson, we thank you for your time.